So we are here with the chairman of the working group 1. The topic there is the dental biofilm-induced gingivitis. And the chairman is Professor Maurizio Tonetti and Professor Moritz Kebschull. And I want to start with a general question to Maurizio. What is the key points of the discussion in the working group? And what are the objectives of that working group during the Perio Workshop on gingivitis and acute periodontal diseases?
So essentially, we always believe that managing gingivitis is easy. It is not as easy as we think. So basically, we need to look for the different components of this treatment: professional interventions, oral hygiene interventions, self-performed by the patients, performed by the professionals, and also look at adjuncts that can be added on for the management of gingivitis. So we have to find, first of all, the scope of what can be done, and then decide what are the things that actually work, and then put it together into a reasonable framework that will increase the effectiveness of the management of gingivitis.
And one more question on that. Is it important to treat gingivitis? We always hear about everyday clinical practice about periodontitis and the bone destruction, all that stuff. Is gingivitis important?
So we have very clear one point, and it is that once you have periodontitis, it never goes back, and it gets worse and worse unless it's diagnosed and managed effectively. The key concept is that periodontitis does not start as such. You need gingivitis first, and then gingivitis will progress in some subjects and in some areas into a deeper form of disease that is periodontitis. So the importance of managing gingivitis is actually the prevention of periodontitis. If we can maintain the oral health, the periodontal health of the population, the objective that we will achieve will be the real prevention of periodontitis. So we are keeping the dam closed, no new cases of periodontitis in the population if we effectively manage gingivitis.
Thank you very much. So, Moritz, do you have something to add on that? And moreover, can we actually effectively treat gingivitis, and how we can do that?
Well, I mean, we are doing an S3 level clinical practice guideline here to give our colleagues in practices worldwide the tools and the things that do work. And there's a lot of research that we have been working through with a very systematic approach. That was the GREAT approach that goes from evidence to a decision that we can be really confident in. And these guidelines will, as Maurizio has outlined, give a clear structure, similar to the guidelines we have made on stage 1 to 3 periodontitis, stage 4 periodontitis, and periodontitis, on how to most effectively and efficiently tackle the grave international problem of gingivitis. Maurizio has outlined very clearly that preventing periodontitis by dampening, by effectively treating gingivitis is a major health outcome. And indeed, the FP has in the past, with the First Economist project, shown very beautifully how powerful also in national or in public health viewpoints tackling gingivitis can be. So yes, Boris, we can treat gingivitis effectively, and we should.
And one last question to both of you. We'll start with Maurizio. Which are the challenges you faced or you are still facing in trying to translate scientific evidence to clinical guidelines for everyday practice to treat periodontitis?
So I think what is really very important here is to understand the process. Moritz highlighted this idea as 3 guidelines. For you, in practice, what this needs is that we have gone through a mechanism that ensures that you can trust what we are telling you. And being able to trust actually means that we went through a transparent process, and this transparent process is there to filter the noise out of the evidence, make sure that we separate what we really know from the opinions and sometimes the false beliefs. And by going through this process in a very robust and transparent way, we end up with few so-called recommendations. And these recommendations, if I now look at it from the standpoint of the receiver, actually are very simple elements that tell us, okay, if you now want to put together for your individual patient the best management for gingivitis, what are the ingredients that you can put into this management plan? And many of the ingredients are things that we know very well. And I'm sure that the discussions in the workshop will actually identify ingredients whose importance is going to be bigger, and other ingredients that perhaps we traditionally thought were the most important thing may have a little bit of a less prominent role. So at the end, you should look at what really works, what it doesn't, and then make decisions for your own patients to ensure that you get the best outcome.
Moritz, do you have anything else to add on that topic?
It's fantastic to have the last word on gingivitis. That is exactly the plan. We would like to reduce or remove gingivitis from the picture altogether to primarily prevent periodontitis. And we have strong data. They need a bit of sorting through, but we have a very strong and robust and very, very transparent process in the development of the S3 level guidelines with the great process behind it as outlined by Maurizio. So you can be confident that the upcoming guideline will give you the best estimate of what works today.
Thank you very much. We are expecting all the results, and thank you for all your efforts.